Hi, I'm Phaedra Cress, Executive Editor of the Aesthetic Surgery Journal, and I'm joined today by our newest social media ambassador, Dr. Tony Youn.
Thank you for having me.
Thank you so much for being here. So we would like to talk social media. You've seen in the journal that we are publishing prolifically in this space on social media. We are getting submissions about Facebook and Instagram, Snapchat, different social media outlets. So how does this resonate with you as a practicing aesthetic surgeon and a member of ASAPS? Is this content useful to you? How is it guiding different things that you do on social media?
Yeah, I think it's super important for us as plastic surgeons, especially academic aesthetic plastic surgeons, to go on social media and spread the message, because there's so much misinformation out there that our patients are exposed to, and unfortunately a lot of it does come from social media. And so to take a peer-reviewed journal like this, a very highly respected one that has the newest information on aesthetic treatments, and to be able to spread it from board-certified plastic surgeons who are members of the Aesthetic Society, I mean, there's so much value in that for me it's an honor and a privilege to be associated with it.
So I appreciate that feedback, because we've actually just taken a look at our articles that are specifically tailored towards social media, and we found that it seems to be resonating with our readership as well in terms of citations, number of downloads. So what should we do next? Where do we take this? How do we use this information and apply it?
I think that the next stage, because there's a lot on Twitter going on with different plastic surgeons who are collaborating to spread the message, but the next stage would be to go to more of the photo and video types of channels like Instagram, maybe Snapchat, where people are wanting to see now more, and there's so much great content in the journal. The videos that teach how to do surgery, the before and afters of the newest techniques, that's where I would go with it, is let's show these great before and afters. Let's show patients what we can do with these cutting edge procedures, because that's what they want to see.
They do. I think video is huge right now. We actually just concluded a user survey, a reader survey for the journal, and we had lots of feedback that we're providing enough video content. They like the video content that we're seeing. I think it's the more the merrier. And I think that this is a visually oriented specialty, so it kind of makes sense that they'd want video. Also, I think it's a quick one-off, a minute here, 2 minutes there to kind of look at a technique or a procedure. What type of video content are you most drawn to?
Well, the stuff that I'm most drawn to is kind of a combination of things that you kind of get to know a day in the life of a plastic surgeon, but on top of that, it's seeing those and hearing those patient stories and seeing those before and after results. And so I follow a lot of different plastic surgeons on Instagram, on Facebook, on Twitter, and I think the stuff that I most enjoy are the little stories, the Instagram stories of doctors going to conferences and doing their talks, of doctors revealing some of their results on these short little video clips, because part of it is that our society as a whole, and probably the world as a whole, our attention span, it seems like it's getting shorter and shorter and shorter.
Sure does.
And even the Snapchat videos are getting shorter and shorter and shorter. So that, I think, for me, being somebody who loves to go from this to this to this, works really well.
That's fantastic. Well, we appreciate your support of the journal. On behalf of Dr. Nahai, thank you for all that you do to help support ASJ, and keep up the good work.
Thank you. It's an honor and a privilege to be a part of it.
Thank you so much.